तो उससे कैंसर के सेल्स लगभग बाहर आ जाते हैं।
यस यस।
और उसके बाद आप 3 महीने बाद
पीएसए
रीवैल्यूएट
देखेंगे,
करेंगे।
इसमें हायर चांसेस है फॉर द पीएसए टू गो अप। देते हैं हम लोग, इंजेक्शन देते हैं जिससे बोन हेल्थ इंप्रूव हो, कैल्शियम सप्लीमेंट्स देते हैं, वी मॉनिटर द हार्ट। देयर आर सर्टेन हार्मोन थेरेपी इंजेक्शन विच आर सेफ फॉर द हार्ट, तो हम लोग वो प्रेफर करते हैं किसी को हार्ट डिजीज अगर पहले से है पूरे और शरीर में है तो इतना मेजर सर्जरी करके भी कोई फायदा नहीं है। सो नो रेडिकल प्रोस्टेटेक्टमी फॉर स्टेज 4। तो बैकबोन ऑफ ट्रीटमेंट फॉर स्टेज 4 इज हार्मोन थेरेपी। इसमें लाइफ लॉन्ग हार्मोन थेरेपी होती है, तो इसमें हम लोग सर्जरी कर सकते हैं, सर्जिकल कैस्ट्रेशन, दोनों टेस्टिस निकाल सकते हैं। बट एवरी पेशेंट बिहेव्स डिफरेंटली। कुछ पेशेंट्स हैं जिनका बहुत डिजीज था एंड विद दिस हार्मोन थेरेपी प्लस सम अदर थेरेपी दैट आई विल डिस्कस, दे हैव हैड वेरी गुड रिस्पॉन्सेज एंड दे आर डूइंग वेरी वेल। कैंसर पूरा खत्म नहीं हुआ है, कहीं कहीं है, बट दे हैव अ गुड क्वालिटी ऑफ लाइफ, सब कुछ ठीक चल रहा है। 4 साल 5 साल हो गए मेरे पेशेंट। सो डोसाटैक्सल कीमोथेरेपी, अबिराटोरोन, एंजाइलोटामाइड, द ड्रग्स, द टारगेटेड ड्रग्स एंड द हार्मोन थेरेपी इंजेक्शन। तो ये 3 हम लोग देते हैं स्टेज 4 में टू कंट्रोल दैट disease. The pathway inhibitor. The androgen receptor testosterone हुआ, pathway is this inhibitor. ARPIs, abiraterone and enzalutamide, and the third one is docetaxel chemotherapy. As I said, median survival would be 6 months.
So you're saying 50% the survival rate is only 6 months to 1 year.
It's widely metastatic. I'm born and brought up in Bihar. My parents are in Bihar, and my initial schooling was from Bihar, Patna only. In fact. From the Bosco Academy in Patna, and post
grows slowly and they're not life threatening.
So that's a myth. It all depends again on the aggressiveness of the prostate cancer, the cells that are inside the prostate cancer. Most of the prostate cancer are not very aggressive. It's when we do the treatment. So if it's a Gleason 3+3, you can be on active surveillance without any treatment, but yes, you monitor your disease.
Okay. तो मतलब आप ये कह रहे हैं कि स्टेज 3 पर भी
Both
आप
options are there.
सर्जरी कर सकते हैं,
Yes.
जिसमें आप प्रोस्टेट ग्लैंड भी निकाल देंगे, लिम्फ नोड्स भी निकाल देंगे, तो उससे कैंसर के सेल्स लगभग बाहर आ जाते हैं।
यस यस।
और उसके बाद आप 3 महीने बाद रीवैल्यूएट करेंगे।
इसमें हायर चांसेस है फॉर द पीएसए टू गो अप, सो दोस पेशेंट्स विल नीड हार्मोन थेरेपी वंस द पीएसए गोस अप।
So can we not put this stage also into the same category of 1 and 2 because we're still doing the surgery, right?
But outcomes are different. जैसे उसमें मैंने बोला कि
100% रिकवरी,
इसमें आई एम सेइंग 30% 40% चांस है कि उनको वापस कैंसर आएगा और हम लोग को हार्मोन थेरेपी या रेडिएशन देना पड़ेगा। So these are two very different states.
Okay, so in this let's understand what is
hormone therapy. So as I said, prostate cancer cells thrive on testosterone. So prostate cancer cells को मारने के लिए हम लोग को बॉडी के टेस्टोस्टेरोन लेवल कम करना पड़ेगा। ये 2 तरीके से कम कर सकते हैं, या तो हम उसके प्रोडक्शन को ही हटा दें, which is removal of the testis, that's called surgical castration, या फिर इंजेक्शंस आते हैं जिसको हम लोग मंथली या 3 मंथली इंजेक्शंस देते हैं और ये बॉडी में हार्मोन लेवल्स को कम कर देते हैं, टेस्टोस्टेरोन को खत्म कर देते हैं। दिस इज कॉल्ड मेडिकल कैस्ट्रेशन। सो जो ये लोकली एडवांस डिजीज है, इनमें टिपिकली हम लोग को 2 से 3 साल तक हार्मोन थेरेपी देने की जरूरत पड़ती है। तो इस स्टेज में हम लोग सर्जरी नहीं करते हैं, बिकॉज दैट्स इरिवर्सिबल। एक बार निकाल दिया टेस्टिस तो वापस कैसे लगाएंगे, सो वो इरिवर्सिबल है, तो इसमें सर्जिकल कैस्ट्रेशन नहीं करते हैं। फॉर दिस स्टेज वी गिव इंजेक्शंस फॉर 2 to 3 years every 3 months to lower the testosterone level in the body. So this is called hormone therapy. This is the backbone of treatment for prostate cancer for the locally advanced and the metastatic disease.
And we can say this is a non-invasive surgery.
Simple injection, जैसे इंसुलिन का इंजेक्शन होता है वैसा इंजेक्शन होता है,
हर 3 महीने में आपको देना है
इंजेक्शन लगाना होता है।
Just for our viewers, let's understand from you that this hormone that males have, testosterone, how does it help?
Sorry,
टेस्टोस्टेरोन एक मेल को कैसे हेल्प करता है?
So this is the main male hormone. It is responsible for his erectile function. It is responsible for his libido. It is responsible for his orgasm. It is also responsible for his cardiac well-being. It affects the heart also, and it also affects the overall bone health, overall health of the patient. So it has a lot of functions in the body.
तो जब हम स्टेज 3 पे टेस्टोस्टेरोन के लेवल्स कम कर देते हैं तो
So sure, इफेक्ट पड़ता है बॉडी पे।
आपके हार्ट पे भी पड़ रहा है, आप कह रहे हो?
Yes.
आपके बोन्स पे भी पड़ रहा है।
Yes. So with this हार्मोन थेरेपी जो हम लोग देते हैं, तो हम लोग बोन डायरेक्टेड थेरेपी देते हैं, हम लोग इंजेक्शन देते हैं जिससे बोन हेल्थ इंप्रूव हो, कैल्शियम सप्लीमेंट्स देते हैं, वी मॉनिटर द हार्ट। देयर आर सर्टेन हार्मोन थेरेपी इंजेक्शंस व्हिच आर सेफ फॉर द हार्ट, तो हम लोग वो प्रेफर करते हैं किसी को हार्ट डिजीज अगर पहले से है। So all of this we monitor. Okay. But then the benefit that we get by giving this hormone therapy is much more than the side effects it causes by keeping the testosterone in the body by what it causes by removal.
Yeah.
So the benefit disadvantage ratio is balanced, or the benefit हमें मिल रहा है by giving this hormone therapy, it's controlling the prostate cancer. नहीं देंगे तो पूरे body में फैल जाएगा.
Correct. Right. Let's understand stage 4. Stage 4 का क्या treatment रहता है?
So stage 4 is prostate cancer that has gone outside, and typically prostate cancer सबसे पहले vertebra, पीठ की हड्डी में जाते हैं. It goes to all bones, but mostly सबसे पहले vertebra में जाते हैं, and it can go to lymph nodes, sometimes in the liver also. So that is stage 4. Prostate cancer has gone out. So in this stage, we don't aim generally at cure. We call it a systemic therapy. हमारा पहला उद्देश्य होता है कि हम सारे disease को control में करें. और इसमें again the first line is again hormone therapy.
No surgery.
नो सर्जरी टू द ट्यून की वो जो रोबोटिक सर्जरी में बोल रहा था वो नहीं करते हैं, क्योंकि जब पूरे बॉडी में कैंसर है तो प्रोस्टेट निकालने का कोई फायदा नहीं है. एक जगह से निकालेंगे उससे बहुत ज्यादा बीमारी पूरे और शरीर में है, तो इतना मेजर सर्जरी करके भी कोई फायदा नहीं है. सो नो रेडिकल प्रोस्टेटेक्टमी फॉर स्टेज 4. द बैकबोन ऑफ ट्रीटमेंट फॉर स्टेज 4 इज हार्मोन थेरेपी. इसमें लाइफ लॉन्ग हार्मोन थेरेपी होती है, तो इसमें हम लोग सर्जरी कर सकते हैं, सर्जिकल कैस्ट्रेशन, दोनों टेस्टिस निकाल सकते हैं. If patients don't want to go in for removal of the testis, so then lifelong उन लोगों को ये 3 monthly injection लेने होते हैं. So a lot of patients who for psychological reasons don't want the testis to be removed, we keep them on hormone therapy, which is a 3 monthly injection every 3 months for life. So that is the backbone of the treatment, either medical with the injections or surgical removal of the testis.
Sorry, I'll stop you here so that we understand, what is the role and what is the function of testis. After, you cross the age of, let's say 50, 60 or 65. So what is the functionality of?
ये टेस्टोस्टेरोन प्रोडक्शन, एंड टेस्टोस्टेरोन ये सब काम करता है जो हमने अभी.
बट अगर हम वो निकाल देते हैं तो कोई इशू तो नहीं होना
चाहिए. जो टेस्टोस्टेरोन के एब्सेंस में जो इशू होता है बस वही इशू, उसके अलावा और कुछ नहीं है.
मतलब आपका हार्ट,
हाँ, जो टेस्टोस्टेरोन के चलते वो सब है. So we are not concerned about fertility. So a lot of patients, we do this surgical castration and they are fine.
They're okay with it.
Yeah. But obviously we have to take care of their bones. We give calcium and heart health, वो सब करते हैं जो टेस्टोस्टेरोन का फंक्शन है. But per se टेस्टिस निकालने से और कोई इफेक्ट नहीं है. So a lot of patients who cannot afford these injections are expensive, and for life हर 3 महीने पे इंजेक्शन लेना, a lot of patients cannot afford it. So I give them the option of removal of the testis, and a lot of patients get the testis removed. Surgical castration for stage 4 disease.
But that controls the cancer?
Yes. So the control of cancer with the injections and with the surgery is the same. The cancer control power is the same. Either आप injection लीजिए या cancer.
नहीं, मैं वही समझना चाह रहा हूँ. अगर हमने वो surgery करके testis निकाल लिए, तो can they survive, the patients?
Yes, so it depends कि कितना aggressive cancer है, कैसा response आ रहा है. In the hope that the cancer comes down, we do it, and we have to do it. कुछ काम करेगा तो यही काम करेगा. But every patient behaves differently. कुछ patients हैं जिनका बहुत disease था, and with this hormone therapy plus some other therapy that I'll discuss, they have had very good responses and they're doing very well. Cancer पूरा खत्म नहीं हुआ है, कहीं कहीं है, but they have a good quality of life. सब कुछ ठीक चल रहा है. 4 साल 5 साल हो गए मेरे patients को जो injection ले रहे हैं, and they're all fine. Some patients हैं जो एकदम respond नहीं करते हैं to this also, either the injection or surgery. So 1 to 2 years, and that's
is the maximum.
Some patients, when the cancer is aggressive, it all depends on the inherent nature of the cancer, the Gleason grading and all. ये कैसा cancer है, बहुत aggressive है तो 1 to 2 years if it's a metastatic.
अगर बहुत ज़्यादा aggressive भी है cancer, तो what is the time span that they have left?
So median survival would be, I would say, if it's a widely metastatic disease, somewhere between 6 months to 1 year. If it's a widely metastatic disease, even with therapy.
कितने % ऐसा होता है आपके केस?
So median means about 50% of the patients.
50%?
With widely metastatic disease, yes. 6 months to 1 year, even with all the therapy. If it's an aggressive, very aggressive.
So that is why it is the second most common cancer in men, right?
Men, and the 5th most common cause of death in men.
Right.
If it's aggressive. Cancer, prostate cancer की यही अच्छी बात है कि most of the cancers are not very aggressive. But if it's Gleason 4, Gleason 5, and it is detected in a stage where it's spread throughout the body, so then it would be 6 months to 1 year, and they don't respond very well to treatment. इसीलिए important है कि जल्दी पकड़ना prostate cancer. कहाँ हम stage 1 की बात कर रहे हैं जहाँ पे एकदम खत्म कर दे रहे हैं, और कहाँ ये जहाँ पे हम 6 महीने से 1 साल के survival की बात कर रहे हैं. So that is the difference, and this difference can be bridged by awareness and PSA testing.
Right.
So for this stage, coming back to this stage.
Correct.
So hormone therapy makes the backbone of the treatment. Then we have newer agents in the form of tablets. So second line hormone therapy, layman terms में targeted therapy, abiraterone and enzalutamide. So we have newer drugs which are in addition to the hormone therapy and supplement the action of the hormone therapy. So hormone therapy देते हैं, ये newer drugs देते हैं, and अब since the last few years we have added chemotherapy also. So इसको triplet therapy बोलते हैं, तीनों एक साथ देते हैं to strike hard that cancer. So docetaxel chemotherapy, abiraterone, enzalutamide, the drugs, the targeted drugs, and the hormone therapy injection. So ये तीन हम लोग देते हैं stage 4 में to control that disease. Apart from this, there are certain drugs because अभी targeted medicine का जमाना आ गया है, so we do the genetic testing and we find out कि कौन कौन genes tested mutated हैं, and there are certain drugs which act if those certain genes are mutated. तो अगर वो mutations हमें मिलता है, तो we have some drugs which we can add, which can enhance the survival of these patients. So we have some targeted drugs based on the genetic mutations for these patients.
थोड़ा सा हम इसको डिटेल में समझ सकते हैं कि ये जो आज की डेट में टारगेटेड ट्रीटमेंट्स हैं, ये क्या होते हैं और कैसे these are better.
So targeted therapy in layman term targets that cancer cell and that mutation in that cancer cell. Prostate में targeted therapy बहुत in vogue नहीं है जो और cancers में है, but as I said, these drugs for prostate also are available जो उस gene mutation को target कर सकते हैं. So in a way you can call them a targeted therapy. Targeted therapy और personalized therapy की आपको कैंसर हुआ, आपका मैं जेनेटिक टेस्टिंग किया और उस जीन्स में क्या आया उसके हिसाब से मैंने ड्रग्स दिया. किसी और को प्रोस्टेट कैंसर होगा तो उनकी जेनेटिक में कुछ और जीन्स म्यूटेशन निकलेंगे, उसके हिसाब से मैं उनको ड्रग्स दूंगा. सो दिस इज टारगेटेड थेरेपी, पर्सनलाइज्ड थेरेपी.
तो जो ये जो ड्रग्स हम देते हैं ये पर्सनलाइज करनी पड़ती है बेसिस द जीन्स दैट यू आर आइडेंटिफाइंग.
यस, बेस्ड ऑन द जीन्स.
ओके,
राइट. If those genes mutations or deletions are present, then these drugs will act. अगर वो जेनेटिक प्रोफाइलिंग में वो नहीं है, तो वो नॉर्मल दिख रहा है जीन, तो मैं ड्रग दे भी दूंगा तब भी काम नहीं करेगा.
राइट.
सो दैट इज टारगेटेड थेरेपी.
आप एक और थेरेपी की बात कर रहे थे, एक और ट्रीटमेंट की बात कर रहे थे स्टेज 4 में, वो क्या ट्रीटमेंट है? इसके अलावा आप कह रहे थे कि मैं आपको बताऊंगा अभी.
ये हार्मोन थेरेपी का बात कर रहा
हूं. नहीं, हार्मोन थेरेपी
तो सेकंड लाइन हार्मोन थेरेपी व्हिच इज targeted for prostate, which is abiraterone and enzalutamide. So these are in the form of tablets, and these act on receptors in the prostate. वो receptor प्रोस्टेट कैंसर सेल पे रिसेप्टर्स होते हैं, जब टेस्टोस्टेरोन आके इसमें रिसेप्टर पे बैठता है तब ये ग्रो करते हैं. सो दीज टैबलेट्स एंजालुटामाइड, अबिराटोरॉन ब्लॉक दीज रिसेप्टर्स. तो अगर बॉडी में टेस्टोस्टेरोन है भी तो भी वो काम नहीं कर पा रहा है. सो दिस इज अ फॉर्म ऑफ टारगेटेड थेरेपी यू कैन से, एंड दिस इज द न्यूअर ड्रग्स व्हिच आर अवेलेबल फॉर प्रोस्टेट कैंसर. तो फर्स्ट वाज हार्मोन थेरेपी, देन दिस इज अबिराटोरॉन, एंजालुटामाइड. ARPI बोलते हैं इनको, एंड्रोजन रिसेप्टर पाथवे इनहिबिटर. एंड्रोजन रिसेप्टर टेस्टोस्टेरोन हुआ, पाथवे इज दिस इनहिबिटर. ARPIs abiraterone and enzalutamide, and the third one is docetaxel chemotherapy.
राइट. तो ये हम तीनों ही एक साथ देते हैं
अब देने लगे हैं बिकॉज स्टडीज हैव शोन. पहले हम लोग क्या करते थे कि पहले हार्मोन थेरेपी और अबिराटोरॉन देते थे, इससे टिपिकली कंट्रोल 1 से 1.5 साल रहता है, उसके बाद फिर डिजीज बढ़ने लगती है, पीएसए बढ़ने लगता है. तो फिर हम अब ये तो मैंने बोला लाइफ लॉन्ग चलेगा हार्मोन थेरेपी, फिर हम अबिराटोरॉन बंद करते हैं और डोसेटैक्सिल इंट्रोड्यूस करते थे पहले. बट रिसेंटली पास्ट इन द लास्ट ईयर वी हैव हैड ट्रायल्स व्हिच हैव शोन कि अगर तीनों को देंगे तो रिस्पॉन्स सबसे अच्छा आता है. सो अब हम लोग क्या करते हैं, इफ द पेशेंट इज फिट फॉर कीमोथेरेपी एंड डिजीज बहुत ज्यादा है, लिवर ये सब में है, तो हम लोग हार्मोन थेरेपी तो देते ही हैं, अबिराटोरॉन ARPI जो है वो देते हैं, और डोसेटैक्सिल कीमोथेरेपी भी ऐड कर देते हैं, सो एज टू स्ट्राइक द कैंसर हार्डेस्ट.
आपके एक्सपीरियंस में जिसको स्टेज 4 कैंसर है उसका सर्वाइवल रेट मैक्सिमम कितना हो सकता है?
सो जैसे मैंने बोला कि आई हैव हैड पेशेंट्स जो 4-5 साल भी दे आर डूइंग वेल. सो दे आर ऑन हार्मोन थेरेपी, दे आर ऑन अबिराटोरॉन, एंजालुटामाइड, कीमोथेरेपी भी लिया होगा पहले, बट अभी दे आर डूइंग वेल. मैक्सिमम तो भी 5 साल तो है मेरे पास.
नॉट बियॉन्ड 5 years.
इट्स डिफिकल्ट.
If they're
5 भी बहुत ऑप्टिमिस्टिक है.
5
As I said, median survival would be 6 months to 1 year. I would be optimistic.
So you're saying 50% the survival rate is only 6 months to 1 year.
If it's widely metastatic. But having said that, we have patients जो 4-5 साल भी, because उनका थोड़ा बहुत ज़्यादा वाइडली मेटास्टेटिक नहीं था, एक दो जगह कहीं गया, उनको सिम्टम हुए, पकड़ में आ गया, we started the therapy, they responded very well. So our hormone therapy भी अच्छा चल रहे हैं, तो अभी 4-5 साल हो गए.
इसमें भी एज क्या मैटर करता है? अगर वो यंग एज में है तो द रिकवरी इज फास्टर.
Yes, because the body is stronger. So chemotherapy, hormone therapy का भी effects होता है बहुत सारा. तो if the body is stronger, the response is good.
Let's understand about the side effects of these drugs that we are giving.
So जैसे मैंने बोला कि हार्मोन थेरेपी, इनका काम है टेस्टोस्टेरोन को कम करना,
बंद कर देना.
So it causes something called as andropause in males. जैसे menopause होता है females में beyond the age of 50 जब उनका estrogen levels कम हो
कम हो
जाता है,
जाता है।
so it's called menopause. So यहाँ पे हम लोग मेडिसिन से andropause cause करा रहे हैं, टेस्टोस्टेरोन खत्म कर रहे हैं. जैसे फीमेल से menopause होता है, मेल्स में इन मेडिसिन के चलते andropause हो रहा है और वही सिम्टम्स होते हैं जो फीमेल्स में होते हैं. हॉट फ्लशेज आना, अचानक से बहुत गर्मी लगनी, स्वेटिंग होना, ब्रेस्ट एनलार्जमेंट इन मेल्स, गायनोकोमास्टिया बोलते हैं इसको, बट ये शुरुआत में नहीं होता है, आफ्टर इयर्स ऑफ हार्मोन थेरेपी ये होता है. सो ऑल ऑफ दिस हैपेंस विद हार्मोन थेरेपी. These are minor side effects which can be easily managed with medicines. So this is for the hormone therapy. And as I said, bones को थोड़ा सा weak करते हैं,
वीक कर
bone
देते
density
हैं।
कम होता है, so we give injection to maintain the bone health. कैल्शियम सप्लीमेंट्स देते हैं हम लोग, वी मॉनिटर दैट कार्डियक फंक्शन एंड ऑल ऑफ दैट. सो ये सब करना पड़ता है. ये सब हार्मोन थेरेपी के थोड़े साइड इफेक्ट्स होते हैं.
राइट।
For the chemotherapy, docetaxel chemotherapy, yes, chemotherapy is toxic. It does cause side effects, but ये उतना टॉक्सिक नहीं जैसे पुराने कीमोथेरेपी होते थे कि सारे बाल निकल गए, ये सब वैसा नहीं होता है. But yes, when you take the chemotherapy, you will have nausea, vomiting, loose stool, generalized weakness, malaise, ये सब रहता है. But these are all temporary. जब कीमोथेरेपी चल रही है और कीमोथेरेपी मिलने के 3-4 दिन बाद तक और एक बार कीमोथेरेपी खत्म हो गई, then you are back to normal.
नॉर्मल।
सो ऐसा कुछ बहुत ज्यादा साइड इफेक्ट नहीं है जिसके चलते हम वो मेडिसिन न लें. उसका बेनिफिट बहुत ज्यादा है, अगर लेंगे तो उससे फायदा बहुत ज्यादा है.
राइट। लेट्स अंडरस्टैंड a little about yourself कि आप कहाँ से हैं, कहाँ से आपने अपनी स्टडीज करी हैं, तो थोड़ा आप अपने बारे में बताएं।
So I'm basically from Patna, Bihar. I'm born and brought up in Bihar. My parents are in Bihar, and my initial schooling was from Bihar, Patna only, in fact, from Don Bosco Academy, Patna. And post my schooling, I went to Mumbai. Mumbai में KEM hospital है, जहाँ से मैंने अपना MBBS किया. MBBS के बाद Masters in Surgery, which is MS in Surgery, that I did from AIMS New Delhi. और जनरल सर्जरी में मास्टर्स करने के बाद देन वी स्टार्ट विद आवर यूरोलॉजी ट्रेनिंग व्हिच इज कॉल्ड एमसीएच इन यूरोलॉजी. एंड उसके लिए मैं पीजीआई चंडीगढ़ गया. सो 3 years इन एम्स न्यू दिल्ली और उसके बाद 3 years इन पीजीआई चंडीगढ़. सो आई वाज ट्रेन्ड इन यूरोलॉजी एट पीजीआई चंडीगढ़. उसके बाद
आपने ये स्पेसिफिक सब्जेक्ट कब डिसाइड करा दैट यू वांट टू बी स्पेशलाइज्ड इन दिस सब्जेक्ट?
सो आई थिंक आई ऑलवेज वांटेड टू डू सर्जरी. सो एमबीबीएस के बाद तो सर्जरी करनी थी, विच इज जनरल सर्जरी. सो दैट्स द पाथ यू टेक for any surgery. You have to do a master's in general surgery. So I did surgery in AIMS. And during my, I think, second year only, or probably the beginning of third year of general surgery, I realized that I want to do urology. More so for these 3 typical cancers that I wanted to treat: prostate, bladder, and kidney cancers. And us samay, the robot had just come in. All India Institute was the first institute in India to have the surgical robot. And seeing such a machine, the magic that this machine could do inspired me. Fascinated me. And prostate is one surgery where the robot is needed beyond doubt. Or as I said, वो जमीन आसमान का difference कर देता है robot in the patient's life. So for robotic surgery and for treating prostate cancer, I chose urology. And I went to PGI Chandigarh for my training in urology. Post that, I worked for a couple of months in Patna. I went back. Training के बाद मैं पटना गया to probably सोचा कि अपने लोगों को थोड़ा सर्व करूं, इसलिए पटना गया. And then after that, I was selected as an assistant professor in AIMS Rishikesh. So I went to AIMS Rishikesh. I was there for 2 years in AIMS Rishikesh. And then I realized कि I need some specialized training इन रोबोटिक सर्जरी. रोबोटिक सर्जरी कर तो सकते हैं, लेकिन जो फिनेस है एंड जो आर्ट है उसके लिए मुझे कुछ एक्स्ट्रा सीखना है. एंड देन आई फाउंड आउट कि कहाँ पे देयर आर फेलोशिप प्रोग्राम्स हु ट्रेन यू वेरी वेल इन रोबोटिक सर्जरी. एंड देन लकीली आई गिव सेवरल इंटरव्यूज एट अ लॉट ऑफ प्लेसेस इन यूएस, यूके. बट लंदन में यूनिवर्सिटी कॉलेज लंदन हॉस्पिटल है. दिस इज वन ऑफ द लार्जेस्ट सेंटर्स ऑफ द होल ऑफ यूके डूइंग प्रोस्टेट सर्जरीज, एंड दे सिलेक्टेड मी. So I went to UK for my training and I was there for 2 years. And 2 साल सिर्फ prostate cancer and bladder cancer की surgeries सीखी on the robot. And these 2 years changed my life. So they made me a robotic surgeon. They helped me understand prostate cancer and bladder cancer as never before. Prostate cancer, bladder cancer treatment जो किताब में पढ़ा था वो तो पता था मुझे जाने के पहले, but जो 2 साल में वहाँ रहा, I got another perspective of these cancers. Much beyond what's written in the books and much beyond what we do. And that has really helped me. And that has helped my patients, basically. So what I can offer my patients. So after my fellowship there था 1 ही साल का, but then I extended for 2 years. I stayed there for 2 years, and then I came back to India, and उसके बाद दिल्ली में ही.
तो वहीं नहीं आपने सोचा सेटल हो जाए?
बहुत लोग ये क्वेश्चन पूछते हैं मुझसे. एक तो की शुरुआत से ही, एज आई सेड, मैं पटना चला गया था टू सर्व माय पेशेंट्स. सो आई हैव दिस दैट आई नीड टू सर्व माय पीपल. एंड जब वहाँ 2 साल रह लिया, देन आई रियलाइज्ड कि I'm a little oriented, and I'm a family man, so I need my family, my parents, my in-laws, my whole big joint family together. So that's the reason why I felt that I need to come back. I have fulfilled what I came here for. I have learned जिस चीज के लिए मैं आया था मेरा हो गया है वहाँ पे. I had some options of staying back there, but then I decided that this is the time I need to take the hard decision
To go back.
and to go back. My wife was not at all happy to come back.
You were married
I
then?
was married then, yes.
Okay.
So she was not happy. She was working in London
Okay.
with me there, and I uprooted her and got her back. So she's to the tune that she said, ki, we are going from London to Gaon, we are going to Gurgaon. So from London, we're coming back to a Gaon. So she was not at all happy, but then it was a decision that I had taken to come back. And I'm so glad that I did, because I now see what I can do for my patients. I feel very good when I can, what I've learned there, I can offer it to my patients here.
Right.
And it is making a difference in their lives.
But let's understand, in terms of कितना लंबा आपका journey रहा in terms of education.
So for a doctor, education, it's a never-ending process. I still read every day. I still see videos, surgery के videos, कुछ नया technique आया है. So I'm still learning. It's not ended. But talking about the courses, so it's a 5.5 years for MBBS, 3 years for MS, 3 years for my MCH. So that's 11 and a half, plus 2 years of my fellowship. So 13 to 14 years is hardcore studies.
Wow. And typically all the surgeons like yourself, they have to go through this.
So at
13 to
least
14
till
years.
most of them, they do a super specialization. After their masters, they do a 3 years MCH super specialization, and now most of them go for their fellowships also. So it's typically a 1 year fellowship. So anywhere between 12 to 13 years to be
Is
a
the
super
minimum.
specialist is what you need to invest
Right.
in training.
और अब आपको यहाँ मैक्स में प्रैक्टिस करते हुए कितना टाइम हो
So
गया?
it's almost about 3 years since I came back from London.
Okay.
So it's 3 years that we came back to London.
So
and
2021, 2022.
21 and 22 beginning I came back. Yes.
And आगे आप क्या सोचते हैं, क्या करना चाहते हैं?
Keep doing what I'm doing. I'm very happy with what I'm doing. So, और काम करना है. I want to train other surgeons also. सब लोग नहीं जा पाते हैं UK में. So we have fellowship programs. I'm training surgeons. I want to expand the team of trained robotic surgeons who can do quality surgeries and help our patients. So it's just increasing the awareness about prostate cancer, bladder cancer, kidney cancers. That's my forte. So increase the awareness and train for future surgeons to do world-class surgeries and give the best to our patients here.
Right. तो हमने जब शो शुरू किया तो आपने बोला लैक ऑफ अवेयरनेस है.
Right.
वो अवेयरनेस बढ़ाने के लिए आप पर्सनली क्या स्टेप्स लेना चाहते हैं?
कोशिश कर रहा हूं मैं अवेयरनेस बढ़ाने की, and I'll tell you, this is one of the major step. Social media is the biggest way to spread awareness. Everyone on their phone have Facebook and Instagram, and for professional people, LinkedIn. So one is social media. We have programs for the patients. We have a very special program wherein we call all our previous prostate cancer patients. So we have a prostate cancer support group wherein we have treated all our patients. So once a year, we get all our patients together. We have half a day function for them. So these functions we keep doing, wherein these functions spread awareness in themselves. We have talks almost every month. I have 2 to 3 talks where I talk about prostate cancer, especially screening and the treatment options available, not for doctors, for general public, for general physicians who are general practitioners who are running their clinics in the society, for them. So yes, talks and a lot of educational videos on YouTube and social media, Instagram is, I feel, the way forward.
No, I see a lot of doctors are these days doing it, spreading awareness, giving education to people, free education to people through their channel. So which is very good and commendable. क्योंकि जितना मैं डॉक्टर्स को जानता हूँ, बहुत ही कम टाइम मिलता है अपने लिए भी निकालने के लिए, एंड देर बिजी थ्रू आउट देयर डे, बट even then, if they're taking out time to educate people, I think which
Which
is
is
very
very
good.
important. It
Yeah.
is important, and all of us as the medical fraternity should do it because it pains when we see a patient coming in stage 4, which could have been picked up a few years back in the stage
Stage one.
1. पूरी लाइफ चेंज हो जाती है, लाइफ ट्रैजेक्टरी चेंज हो जाती है उसकी, एंड इट्स जस्ट लैक ऑफ अवेयरनेस. चीजें हैं हमारे पास, टेस्ट है, ट्रीटमेंट है, बट द पेशेंट्स हैव टू कम फॉरवर्ड. उसके लिए दे नीड टू नो. बहुत पेशेंट जेंटलमैन ऐसे होंगे जिनको पता नहीं उनको प्रोस्टेट ग्लैंड है, प्रोस्टेट में होता है. बहुत लोग ऐसे हैं उनको पता नहीं है कि प्रोस्टेट होता है. बहुत है पता है प्रोस्टेट है, बट पता नहीं है कैंसर हो सकता है. कैंसर हो सकता है तो कैसे उसको पकड़ में लाए नहीं पता. तो ये सब कवर करना है, क्लोज द गैप.
Right. Right. Good. Let's move forward and break some myths
Sure.
for people. Um, so the first myth is that many people think it's the prostate cancer is only for elderly and it's not for youngsters.
So it's true to an extent. Prostate cancer generally presents beyond the age of 60. Having said that, we have seen patients in 50s also. Very unlikely that below 50 you would have prostate cancer. But nevertheless, if you have symptoms, you have to see your doctor, get a PSA blood test done at least. But yes, the general population beyond 60, prostate cancer generally affects beyond 60.
So it's not myth, it's a fact.
It's a fact, yeah.
It's a fact, right? Okay. Some believe prostate cancer are always uh, grow slowly and they're not life threatening.
No, so that's a myth. It all depends again on the aggressiveness of the prostate cancer, the cells that are inside the prostate cancer. Most of the prostate cancer are not very aggressive, they grow slowly. But then, having said that, we have prostate cancers who are Gleason 5+5 and they are aggressive. If you compare it to gallbladder cancer or pancreas cancer, yes, compared to them, they are very slow growing. But that doesn't mean that you just sit on it, you don't do anything about it.
It's still life threatening.
It is life threatening.
Yeah.
Yes, prostate cancer is definitely life threatening.
Yeah. Um, okay. The other myth is that some men fear that prostate cancer diagnosis means immediate surgery or chemotherapy.
No. So chemotherapy is the last step. And before that, a lot of things are there. Even for surgery, as I said, for very low aggressive prostate cancer, Gleason 3+3 prostate cancer, there is a treatment option which we did not discuss. It's called active surveillance. If someone is diagnosed with prostate cancer and he has a Gleason 3+3 prostate cancer, he does not need to go in for a definitive therapy, either surgery or hormone therapy straight away. He can be on active surveillance, in which he doesn't take any active treatment, but he keeps his prostate cancer under check. How do we do that? We do a 3-monthly PSA blood test, a 6-monthly to an annual MRI, and a biopsy year to 2 years time. So we do these tests to see if the PSA is rising or some new lesion has come up on the MRI or the repeat biopsy shows it's no more Gleason 3+3, it's Gleason 3+4, it's when we do the treatment. So if it's a Gleason 3+3, you can be on active surveillance without any treatment, but yes, you monitor your disease.
Okay, sure. Moving on, the other myth is that some people believe frequent sexual activity can also increase the risk of prostate cancer.
No, it doesn't. That's a myth. It will not. Frequent sexual activity, frequent masturbation, it will not increase the risk of prostate cancer.
Okay. Okay. The other myth is that some people feel that eating too much of red meat or dairy products can also lead to prostate
So
cancer.
red meat is associated with a lot of cancers in general. So with prostate cancer also, it would increase the risk of prostate cancer. I'm not too sure about the dairy products. As far as I know, it does not increase the risk of prostate cancer. A lot of patients come to me as soon as they're diagnosed with prostate cancer, they've stopped everything, milk, paneer, everything, and I need their bones to be healthy because I'm giving them hormone therapy. So I tell them to take calcium, I tell them to take milk. So dairy products, I don't think they increase the risk of prostate cancer.
But red meat, you're saying that it contributes to all type of
cancers, and it would increase the risk of prostate cancer also.
Right. Okay, the next one is some men worry that prostate cancer treatment will always cause impotence.
So depends on what treatment are you taking. If you go in for a surgery and if it's a localized prostate cancer and if we are able to save all your nerves, you would not get impotence. You would still have erectile function. A lot of my patients after the robotic surgery are sexually active. They have regular sexual intercourse because their erections are good. So in surgery for initial stage prostate cancer, when we are saving all the nerves through a robotic approach, will not lead to erectile dysfunction. If it's an advanced disease in which the prostate cancer has gone to the nerves and we are removing the nerves during the surgery, yes, you would have some degree of erectile dysfunction, for which you will require some help once you've completely recovered to regain your erections. And we have a lot of treatment options available for that in the form of tablets, injections, devices, which help them regain the erections even if the nerves have been removed. So it does not lead, it leads to erectile dysfunction, the locally advanced treatment for locally advanced prostate cancer, but there are treatment options available for that. If you're on hormone therapy, yes, you would have erectile dysfunction
because
because
the testosterone
is
levels are
going
going
down.
down.
Yes, absolutely.
Right. Okay. The next one is some men avoid PSA testing because they think it's painful or invasive.
Now, it's not painful at all. It's a simple blood
Blood
test.
test.
Simple blood test. You
Yeah.
draw one sample, it's painless, and you have the result in less than 24 hours.
Okay. So
Absolutely.
it's a myth.
It's a myth. It's a simple blood test.
Right. Some believe that once treated, prostate cancer can never come back.
No. So any cancer has the potential to come back.
Relapse.
You relapse. So for any cancer, there is always a percentage that it will come back. It depends on what the initial treatment was, how well was it treated, and what's the underlying biology of the cancer. But even the best cancers have
Will
a
come
small
back.
percentage
Can come
that
back.
can come back. That's the reason why all our patients are under follow-up even after complete curative treatment.
Right. Right. So it's also a myth.
Myth, yes.
Okay. So before we end, any final tips that you would want to give to our viewers?
The only message that I want to give to all your viewers is that health is the biggest asset. And especially men, take your health in your own hands and be proactive about your health. Do not ignore any symptom in your body. We talked only about prostate cancers, but any symptom that you have, pain in the abdomen or anything, go see your doctor, because very easily available tests are we have with us today, which can pick up any abnormality in the body. If you have pain in the abdomen, get an ultrasound done. If you have any urinary symptoms, get a PSA done. See your doctor. Don't ignore your health, because earlier the diagnosis, greater the chances that your doctor would be able to completely cure you of the cancer. Cancer is going to stay with us. It's not going to go anywhere else. The incidence is going to rise. We have to face it, take it by the horns, get the complete treatment done, and emerge triumphant.
No. But any steps that people can follow just to, you know, I think what I've understood from our discussion is that prostate, uh, that BPH is something that elderly people will still develop.
Develop,
But
yes.
can we delay that process?
So a healthy lifestyle, diet rich in vegetables, antioxidants, less of red meat, physical activities, exercises, jogging, walking, all of these would reduce your risk of getting enlargement and the cancerous development in the prostate. This would help in any
Yeah, I
cancer
think
or
it's something which is
carcinogenesis
a common phenomena
for all cancers.
for everything.
Everything. That's absolutely heart disease and everything, diabetes,
To
everything.
lead a healthy
Healthy
lifestyle.
life, yes. That's the bottom line.
Yeah, that's
Lead
the
a
bottom
healthy
line.
life. Obviously, with no smoking, reduce your alcohol intake, all of these add to the chances of having a cancer.
Right. I think that's the key message, to stay healthy and be fit. And with that, we end our show today. And before I thank my audience, I would like to thank Dr. Tushar for taking out time and spreading this education about prostate and prostate cancer. So thank you so much, Dr.
It's
Tushar.
my pleasure.
It was lovely having you.
Thank you.
And thank you to all our audience as well for watching this video. And I hope you've received some sort of information about prostate and prostate cancer. So if you've liked and if you see somebody struggling with prostate cancer, please do share this video. Let's spread that awareness and cure people. Thank you so much for watching.
Thank you. This is the era of social media, Instagram, Facebook. A lot of us are gone into making podcasts, making reels, making videos. But I truly want to thank and appreciate Mayank and his talk show, the NH Talk Show, the podcast NH Talk Show, for the amazing work that he and his team are doing. He's selflessly going and interviewing doctors and other health enthusiasts to spread the message of being healthy, taking care of your own health. The key in today's world is awareness, and social media is a very powerful channel to spread awareness. And NH Talk Show is doing just the same. So I really salute them for what they are doing, and I'm thankful to them for what they are doing, and I wish them the best of luck, and so that they keep doing these podcasts to spread awareness about being healthy, being fit, and helping the community at large. So thank you, Mayank, and thank you, NS Talk Show, for taking this initiative and reaching out to the masses. Thank you.